you have a lot of people who are, social butterflies and stuff like that. And, they want to get close and they want to hug and they want to, embrace and so on and so forth. And, they can't do those things. And which brings me to another question that I have for you is basically how do you see this pandemic affecting the way we socially interact for the foreseeable future?
Great question. So, I think these practices, are clearly working because based on the infection rate, based on the death rate, again, it's about 2 to 3% of people will pass from this. It's different for everyone. I think that brings up one more myth I wanted to address, which is that, that young people are not affected by this virus. There was a 26-year-old school principal, young woman in Brooklyn who died of COVID. There are reports now, obviously it's much less in terms of children and young people, adolescents, folks under 30. A lot of people are asymptomatic and carrying this around. So the problem is we usually with two things called contact tracing, I can tell who got it from whom and sort of trace it back to where it started. And containment being that I identify someone, I isolate them from everyone else so that they're not in play anymore and infecting other people.
Tell us a little bit about telemedicine. Tell us a little bit about how it works, how it is helping people, and how it's changing the way the healthcare system operates in it.
Absolutely. So telemedicine can refer to a bunch of different things. It can be as simple as me picking up the phone and going over someone's blood test results, or that's kind of the simplest form that's been going on for decades now. But in practice, really what we're referring to nowadays is being able to use real-time, interactive audio and video, similar to something like this. It's basically a more sophisticated version of FaceTime or WhatsApp or Google Hangout or Zoom or whatever proprietary software there is, interacting with a healthcare professional remotely. The difference being that these apps or programs are all encrypted for privacy protection. You've heard of hacking and Zoom bombing and other things like that, where a conversation that you think is private is not really. There's someone else listening in or recording and trying to exploit that either for getting confidential information for whatever reasons that people do that. So that's the important thing, is that it's secure, it's encrypted, and it's HIPAA compliant, meaning it complies with healthcare privacy laws. When I was sick and had a high fever of 101.7, I was laying on this sofa, pretty much incapacitated and feeling awful. I was able to pick up my phone and, my own hospital, my own healthcare system, I was able to connect with one of my colleagues. There was less than a 90-second wait.
Wow.
I basically picked up my phone, opened up an app, tapped a button. I took a photo of the thermometer in terms of the temperature there. I used my pen light for my white coat and took a view of my tonsils and my throat because I had a horrible inflamed sore throat. And he was able to look at those photos before starting the visit and review the data, review my chart. So that was that kind of 60 to 90 second lag time. And then boom, I was in with an experienced internal medicine physician that I've known for over a decade, who we were able to, take a history, do basic things. Now he can't listen to my heart or my lungs. He can't, you're relying a lot on the person giving you information. There are a lot of limitations. This is not meant to replace a face-to-face visit. It still is the best thing for a lot of things. The same way I, wouldn't break up with someone over the phone, telling someone, unfortunately, I've had to tell people that they have cancer over, a medium like this, which is not the way anyone wants to do anything. But I think it makes a big difference compared to a phone call, being able to look someone in the eye still. Even if there's a distance between you, it seems to close that gap. Medicare and other insurances have started to realize this. And during this crisis, hospitals, unfortunately, are using so many resources and doing amazing work to keep people safe and save lives, and yet not getting paid to be able to pay their employees, buy more equipment, keep things running, because money's not coming in from visits or surgeries and elective things. So telemedicine there's been coding for how that works. Hospitals are now being able to be paid, and physicians being paid for taking care of patients and keep money coming in to keep the doors open and the lights on and doing the good work that they're doing.
A lot of people are misinformed right now. A lot of people are very uncertain about their health, about their finances, about a lot of things right now. And that is the reason why we want to partner up with the experts in terms of finance, in terms of healthcare, that can clear things up a little bit and that can provide some valuable and rich information that can allow people to have a clear mind and a clear understanding of how to live life and how to move forward during such crisis. By and large, we thank you for, coming on, man. We thank you for just giving us all the valuable information and facts that you have to help people live the best and healthy life that they can possibly live, and continue to practice all the safety precautions that they possibly can to flatten the curve, man.
So, look, I wanted to kind of finish out on by sort of more of a positive note. There again, we don't know who has this. We have to kind of behave as though everybody has it. And that's what's been able to flatten this curve, meaning that it's not shooting off exponentially where everybody's getting infected. We've overwhelmed our healthcare infrastructure, and people are dying as a result of that. This is very serious, but we can get through this. We've done amazing work. Everybody's chipping in by doing what they're doing, by staying at home, doing all these things that people are being asked to do. It's a lot to ask of people, but if you're not doing it for yourself, you're doing it for other people. If people say, 2-3%, those are pretty good odds. If I walked in a casino, I would take those. But if I hand you a bag of Skittles with 100 in them and say that 4 of them are going to kill you, I'm not going to have one. And the thing is, if you're not doing this for yourself, do it for the people who are battling cancer right now. Do it for the people who are sick and elderly. I've got grandparents my grandfather's 92 years old, God bless him, and still with us and a sharp mind and good health. We want to keep it that way. All life is important. We want to preserve life, protect life. These are sacrifices that we've made for generations as Americans and as world citizens in times of war and famine and hardship. We've been through them, we've gotten through them, and we've gotten through them together. So I would advise people to continue doing the amazing work that everyone's doing. Stay positive. This is a tough time for physical health and also mental health. I have a good friend who, and former, classmate and colleague, who's, a child and adult psychiatrist at Harvard, incredibly proud of the work that she's doing. Mental health is very important. People are more susceptible to domestic violence and other things right now when they're cooped up in close quarters and times are difficult. So, we all need each other now more than ever. So I'm so proud of the work that you guys are doing, that a lot of, restaurants have stepped up to feed people and help people out. So we all need each other. We're social beings. We're, as human beings, we want to be with other people, and we need each other now more than ever. So even though we're isolating, we can leverage technology, community, other things like that to bring ourselves together and to get ourselves safely through this crisis. Thank you so much, Sean.
Thanks, Dr. Raj. Appreciate you, man. We'll talk soon.